Who said returning to perfect prostate health was impossible? If you want to return an enlarged prostate to its correct size, you can. What is the prostate? What's normal prostate? Many men aren't sure what their prostate is, what it does, or when to call a doctor if they think they might have a problem. What does my prostate do? It is a small gland that is part of the male reproductive system. It's supposed to be about the shape and size of a walnut. It rests below your bladder and in front of your rectum. It surrounds part of the urethra, the tube in your penis that carries pee from your bladder. The prostate helps make some of the fluid in semen, which carries sperm from your testicles when you ejaculate. As you age, your prostate can become larger. It's a normal part of aging for most men. By the time you reach age 40, your prostate might have gone from the size of a walnut to the size of an apricot. By the time you reach 60, it might be the size of a lemon. Because it surrounds part of the urethra, the enlarged prostate can squeeze that tube. This causes problems when you try to pee. Typically, you won't see these problems until you're 50 or older, but they can start earlier. You might hear a doctor or nurse call this condition benign prostatic hyperplasia, or BPH for short. It is not cancerous. If you have trouble starting to urinate or have to go a lot, especially at night, these could be signals that you have an enlarged prostate. Other signs and symptoms include, your bladder doesn't empty completely after you pee. You feel the need to go out of the blue with no sensation of buildup. You may stop and start several times. You have to strain to get any flow going. For thousands of men today, BPH can be cured as quickly as it arises. There's no longer any need to suffer from an enlarged prostate gland. Today, the prostate can be shrunk quickly and simply. So, continuing with BPH is a choice. And getting rid of BPH is a choice too. Scot Davis's The Prostate Protocol Review. What is prostate protocol? Scot Davis's The Prostate Protocol takes a highly logical approach. Consider this: your prostate was normal-sized once. Whereas it's not now. Now it's too big. But there's a reason it's too big. It didn't just happen. Something caused it to be enlarged. Now, we have long known that hormonal imbalances in a man cause the prostate to grow out of control. In particular, if you have an enlarged prostate, then right now your estrogen and testosterone hormones are way out of balance. For as long as your hormones stay like this, you'll always have BPH. Unfortunately, we've never actually known why that hormonal imbalance is happening. This is why BPH treatments are so unreliable. Doctors are guessing to some extent. To get a shot of BPH, we need to straighten out the hormone problem. But how do you do that if you don't know what messed them up in the first place? Well, that's what has changed. Before moving ahead, if you want Scot Davis's The Prostate Protocol at a limited price, do check out the link in my description box or comment box below. Watch this video to the end to know whether prostate protocol is for you or not. How does Scot Davis's The Prostate Protocol shrink the prostate? The hormonal imbalance that leads to BPH is caused first of all in the gut. Yes, the gut. But here's the thing: human gut bacteria has been with us since the dawn of time. It doesn't just keep us healthy, it keeps us alive. There are hundreds of types of bacteria. Each type has its own job to do. When they're healthy and plentiful, our gut bacteria minimize inflammation, protect us from heart and kidney disease, manage our weight, regulate our cholesterol, stabilize our blood sugars, keep our moods consistent, and perform dozens of other tasks that make our lives possible. And guess what else these little helpers do for us? They regulate, manage, and stabilize male hormones. In particular, they make sure the ratios of estrogen and testosterone are exactly how they need to be. Because when those two get out of whack, guess what you end up with? Benign prostate hyperplasia, BPH. But here's the problem. These bacteria are delicate. So they need exactly the right nutrition, the right conditions to thrive. Western diets and lifestyles aren't helpful in this regard at all. It's not your fault or mine. But over the years, our valuable, life-saving gut bacteria are dying off at extraordinary rates. And we're paying a hefty price for that. which explains why Westerners have heart disease, organ disease, obesity, and a range of metabolic conditions on a scale unheard of in some other parts of the world. Years of slowly killing off our life-giving gut bacteria eventually make us ill. And BPH is one of the consequences of the onslaught against gut bacteria. BPH simply can't get better until our gut bacteria get better. This is Scot Davis's, the prostate protocol area of expertise. For any particular illness, he directly targets the bacteria loss that has caused that disease. It focuses on the specific bacteria that we need in order to make things right again. The Prostate Protocol is a comprehensive program that explains how some men are experiencing hormonal imbalances that cause the prostate to grow out of control and force them to suffer from benign prostatic hyperplasia (BPH). It happens because of the imbalanced hormones estrogen and testosterone hormones. This guide will share the truth about solving the hormonal imbalance and reliably treating the BPH. This guide will share the secret way to balance the desired hormones and convert the prostate gland size to normal. Cons. Without an internet connection, you are not able to access this program. The Prostate Protocol is available only online. If you left any information or steps, you will miss the chance or be delayed to see the desired result. Do not expect an overnight miracle, and you must be patient to notice the mind-blowing result. Pros. No repeat cost, no subscription fee, no renewal fee, no equipment, drugs or treatments to pay for less than the cost of one doctor's visit or one subscription of medications, you are treating your BPH at its source, ending nighttime peeing and removing the risk of numerous diseases. If, at any time within 60 days of you purchasing the Prostate Protocol, your symptoms haven't completely evaporated, then you can have all your money back. Do this for yourself today. Start making a difference to your condition right now. Click on the link below the description of this video or the comment box to receive your copy of the Prostate Protocol in just a few minutes. It'll be one of the best decisions you've ever made, guaranteed. Don't forget to subscribe to my channel to help YouTube algorithm. Thanks for watching.